My name is Cheyenne, and I'm going to be talking to you about maternal mortality in the United States. The CDC defines maternal mortality as the death of a woman during pregnancy or within 1 year of the end of a pregnancy from a pregnancy complication, a chain of events initiated by pregnancy, or the aggravation of an unrelated condition by the physiologic effects of pregnancy. So that basically just means that a woman has died during or after childbirth. And I think that it's really important to talk about maternal mortality because that is when a mother is dying and she can't raise her baby is growing up without a mother. It's just really sad. And I think that it's important to talk about and to try to find a solution to this issue. So, more American women are dying of pregnancy-related complications than any other developed country. Only in the U.S. has the rate of women who die been rising. American women are now 3 times as likely to die from pregnancy-related complications as their counterparts in Britain, the Czech Republic, Germany, or Japan. And that's really scary because I don't understand why we're so much higher than other developed countries in the rate of maternal mortality. So just to illustrate that, I have this graph that shows the United States is going up when the rest of these countries are going down. And it's not even just going up at like a slight raise, like it's going up significantly. So I would really like to figure out why that's happening. So there are a lot of reasons that maternal mortality is going up and why the women in the United States are not getting the care that they need. The first one is that women are now waiting until their 30s and 40s to have children. And that is a little bit dangerous because there's higher risk for complications whenever you have an older woman who's trying to have a child. On the other end of that spectrum, there are really young women who are having babies and they're not prepared for pregnancy and for actual childbirth, and they're not prepared. C-section rates, so those have gone up and probably due to age. And C-sections are higher rates for infection and they are a lot longer to heal from than a natural childbirth. And then the healthcare system is not set up for women who don't have that much money to be having a baby. Women in poverty make up a very large chunk of the women that are having babies, and for most of them, healthcare is not an option. And that can be really dangerous for the mother and her child. And the last but not least, infant care, maternal care imbalance. I thought that was really interesting because the rates of infant mortality have gone down while maternal mortality has gone up. So healthcare providers are focusing more on the babies than the mothers, and so they're missing things, and the mothers they're dying from that. So there are several causes, medical causes, that women can die from pregnancy or during childbirth, and that is severe bleeding, infections, high blood pressure, complications from delivery, and unsafe abortions. So the World Health Organization talks about the preventability of all of these issues that are killing the women. So all of these things are preventable. Severe bleeding after birth can kill a healthy woman within hours if she is unattended. But injecting oxytocin immediately after childbirth effectively reduces the risk of bleeding. So that's preventable. Infection after childbirth could be eliminated if good hygiene is practiced and if early signs of infection are recognized and treated in a timely manner. So infections are preventable. And then preeclampsia should be detected and appropriately managed before the onset of convulsions and other life-threatening complications, which is that high blood pressure, which is also preventable by administering drugs such as magnesium sulfate for preeclampsia can lower a woman's risk for developing eclampsia. So all of these issues are preventable, and it seems like they're not that hard to prevent. So there needs to be some kind of solution here. So I think on a larger scale, our society needs to come together to prevent maternal mortality as well as other healthcare issues. But we need to communicate, because communicating about these issues, it leads to attention being brought to the problems, and with attention usually comes resources. So money could be used to, they could give that to the healthcare providers to have the tools they need and the people ready in case a woman does have this issue, and to just catch it before it happens. Social support is really important because a lot of people feel more comfortable whenever they know somebody's going through the same thing as them or has gone through the same thing as them. So having that comfort there is really important. And then education, communicating about education is important because you can't fix a problem if you don't know that there is one. And then health literacy is just basically the understanding of all kind of the medical terms. And I mean, you don't even have to know all of them. Just knowing a few of them to keep up in the conversation is a lot better than not knowing anything and just tuning it out. And then advocacy is really important. Nonprofit organizations are really good about giving a voice to people who don't have a voice or have had theirs taken away. So they can communicate the needs of the minorities or the women who need their support and help. So that's a really good resource. And then lastly, I wanted to talk about what the World Health Organization is actually doing to prevent maternal mortality rates from going up. So they are addressing inequalities in access to and quality of reproductive, maternal, and newborn healthcare services. So that basically just means that they're understanding that there is this gap between maternal mortality and infant mortality, and it needs to come together. Like, they shouldn't take attention away from the newborns, but they should definitely give more attention to the mothers to make sure that they are going to survive this process. And then ensuring universal health coverage for comprehensive reproductive, maternal, and newborn health care. So like I said earlier, it's really hard for women in poverty to have like safe a healthy like birth and after, because you have to go to appointments all the time and stuff like that. So it would make it a lot easier for these women if they had universal health coverage. Addressing all causes of maternal mortality, reproductive and maternal morbidities, and related disabilities. So that's just kind of understanding that there are a lot of reasons why this can happen and kind of figuring out what we can do to prevent each of those issues. Strengthening health systems to collect high quality data in order to respond to the needs and priorities of women and girls. So that's just kind of collecting data and research and trying to figure out how to best give us what we need. And then ensuring accountability in order to improve quality of care and equity. So the World Health Organization's their target is to reduce the global maternal mortality ratio to less than 70 per 100,000 births. So that would reduce it quite a bit, and that would be awesome. So through those steps, they're trying to do that, and I really hope that they can get that done. Thank you.